This video is an ethical and legal request for your informed consent to undergo sigmoidoscopy, or sometimes called flexible sigmoidoscopy or proctoscopy. Your doctor wants you to understand why the procedure is needed, how it is performed, and will explain potential risks, complications, and benefits associated with the procedure, as well as its reasonable alternatives. To help you better understand sigmoidoscopy, let's first look at how the body's digestive system works. This digestive system is also known as the gastrointestinal tract, the GI tract for short. The GI tract includes the mouth, throat, esophagus, stomach, small bowel, and large bowel. The lower part of the colon is called the sigmoid and ends in the rectum. Part of your lower GI tract can be examined with the use of a sigmoidoscope. With precise movements, your doctor will guide the scope into your rectum around the curves of your bowel to the lower left end of the colon, examining the lower GI tract's lining. The procedure may cause some discomfort. Although the sigmoidoscope is well lubricated, some discomfort may be experienced when it's inserted and navigated through the curves of your intestines. You may experience gas or cramping as air is used to inflate certain areas for a better view. Sigmoidoscopy is a short procedure and sedation or medications are normally unnecessary. Your doctor will further discuss with you if he believes medication is needed. The most common reasons for sigmoidoscopy include, but are not limited to, rectal bleeding, hidden blood in stool, bowel habit change, abnormalities from other GI tests, lower abdominal pain, checkup for previously diagnosed condition, rectal cancer screening to facilitate the treatment of hemorrhoids. The sources of these symptoms may include polyps, usually harmless tissue growths that can sometimes be precancerous, colitis, tumors, diverticulosis, vascular malformation, ulcers, hemorrhoids, or swollen rectal veins. If you've given prior consent, your doctor may treat any abnormalities seen during the exam. If found, polyps may be removed or a biopsy may be taken. There is no feeling inside the colon, so you won't realize this procedure is being done. Because the site can be seen so clearly, your doctor can determine if more tests are needed and develop a treatment plan for the diagnosis. Sigmoidoscopy is usually safe and associated with very low risk. However, you should be aware of all possibilities. Other than the pain and discomfort, risks include a tear of the colon or rectal wall, bleeding, cardiac or respiratory complications, reaction to medication, infection, possibility of missing a lesion or cancer, other risks specific to your physical and medical condition as discussed with you by your doctor. Risks that are extremely rare but remain a possibility include death, brain damage, disfiguring scars, paralysis, loss of function of an organ or limb. Sigmoidoscopy is a very accurate diagnostic test. Many doctors consider the test to be cost-effective and low risk. There are alternatives to sigmoidoscopy. However, they are considered to be either less accurate or more invasive. Alternative procedures include colonoscopy, surgery, barium X-ray enema, barium enema, blood vessel X-rays, nuclear scans, open abdominal surgery. The decision to have sigmoidoscopy is yours and should be based on your doctor's evaluation of your particular problem. If you decide not to have the procedure, be aware that your doctor may not be able to properly diagnose or treat your condition, which could worsen or possibly spread. This video can be helpful in your right to informed consent for sigmoidoscopy, but should not be considered a substitute for discussion with your doctor.